If you think you have erectile dysfunction, also called ED, or have already been diagnosed, there are treatment options that are available that may help you regain control of your life. It can be helpful to learn about the available treatment options, and I will work with you to determine which solution is best for you. Treatments for ED include oral medications, penile implants, penile injections, vacuum erection devices, and insertable medications. Oral medications with names including Viagra, Cialis, Levitra, or Stendra are the most common type of treatment for ED. Typically, oral medications must be taken at least 30 minutes before sex to produce an erection in response to stimulation. An option that a lot of people are not familiar with is an inflatable penile implant. A penile implant like the Titan penile implant from Coloplast typically is an outpatient procedure that provides a long-term solution for ED. These implants were designed to mimic the look and the performance of a natural erection and are placed completely inside the body through a small incision either in the scrotum or the abdomen. Another treatment option for ED is penile injections, a treatment which requires you to give yourself a shot in the penis 5 to 20 minutes before sex to get an erection. Vacuum erection devices are another treatment option for ED. They are external pumps consisting of a cylinder and a pump that is placed over the penis and pumped to create a vacuum that pulls blood into the penis, creating an erection. Once erect, a constriction ring is slid down to the base of the penis to help maintain the erection. And finally, a less commonly prescribed treatment option is insertable medications. An applicator containing a small pellet is inserted into the urethra, the urinary channel, and the pellet is released. The medication in the pellet creates an increase in blood flow to the penis, creating an erection. Oral medications have been proven to be effective for many, and over 60% of men are able to achieve a satisfying erection using these medications. Although oral medications work well for many, they don't work for everyone, and 40% of men don't respond. Also, if you have certain pre-existing conditions and are taking certain medications such as nitrates for cardiovascular disease, this treatment option isn't available for you. With these medications, you could experience side effects such as headaches, flushing, upset stomach, pain, and muscle aches, as well as nasal congestion. When oral medications are ineffective or unavailable, penile implants can be an effective long-term solution. This ED solution allows for spontaneity and puts you back in control of your erections without the hassle of pills, needles, or clunky equipment. It's very reliable, and erections can last as long as you want. Like every surgical treatment, there are potential risks with penile implants. The most common risks of penile implants include, but are not limited to, device malfunction, such as a break or leakage, infection, inflation difficulty, erosion, incorrect sizing, and they can make latent natural erections, as well as other treatment options, impossible. Penile injections are another option. These treatments work very well in some patients. However, they require you to self-inject the medication into the penis rather than taking the medication orally. They can also be a bit cumbersome. Some brands require refrigeration, and they can take approximately 5 to 20 minutes for activation. In about 30% of cases, penile injections are ineffective or cause priapism, an erection lasting 4 hours or more that can require a trip to the emergency department. Other side effects include penile pain, numbness or irritation, bruising at the injection site, and penile fibrosis or penile scarring. As stated earlier, vacuum erection devices are external pumps that are placed over the penis. This option requires no oral medication, injection, or invasive procedure and works well for some men. Patients that use vacuum erection devices may have a learning curve, some discomfort, and may find equipment bulky. You may also experience an erection that is cold to touch and may not achieve a sufficient erection for sexual intercourse. As mentioned, Insertable medications are pellets that are inserted into the penis through the urethra. Erections usually start within 10 minutes and last between 30 to 60 minutes. Side effects include burning and aching in the penis and groin. Insertable medications require refrigeration and can diminish spontaneity due to the nature of the preparation. Every patient is different, and every man's journey with erectile dysfunction is different. I look forward to the opportunity to sit down with you to assess your specific situation and expectations to create a treatment plan that is right for you. Not only are penile implants an effective and reliable solution, but they also have the highest satisfaction rates among other treatment options. A study of Titan penile implants showed a 98% satisfaction rate, and their partners were also highly satisfied, reporting a 96% satisfaction rate. One of the long-term consequences of not having an erection is loss of penile length. Like any body part that goes unused for a long time, the muscle and the fibers of that body part begin to break down. If it's been a long time since you've achieved a good erection, you may experience some loss of tissue or atrophy, which can result in shortening of the penis. Additionally, given that the arteries to the penis are smaller and prone to earlier blockages, ED can be an early indication of other health issues such as cardiovascular disease, making this another reason for us to discuss your erectile dysfunction.